Good afternoon. My name is Melissa Duros, and today I'm going to discuss the research article, Educating Health Consumers About Cardiometabolic Health Risk. What can we learn from lay mental models of risk? And this research study was conducted by Olga C. Damon and Danielle R.M. Timmermans. There are wearables, apps, and kiosks located in drugstores to allow people to be informed of their health, and with the access growing, health risk assessment hardware and software have become almost ubiquitous. However, although growing more and more popular, when it comes to understanding the risk of one's behavior on their health, mental models can determine and even hinder this perception. Being accurately informed means that the risk of diabetes, and particularly type 2 diabetes, cardiovascular diseases, and chronic kidney disease can be greatly reduced when an individual chooses to pursue a healthy lifestyle. And not only informed, but the information needs to be conveyed to them in a way that makes sense. Although there has been considerable effort put forth to educate the public on risk factors associated with smoking, not eating a proper diet, or getting enough exercise, people do still make unhealthy choices. One explanation for this is that it is not easy to market to everyone on how risky these behaviors are in a way that people will truly comprehend. The researchers in this study believe that although people read and hear education on how risky behaviors contribute to disease, this is where our cognitive beliefs get in the way when we interpret and how risky these behaviors to be based on our own mental models towards the diseases. Using health risk assessments, they sought to assess the gap between how risky a person sees a behavior and the true detriment that it could have on their health. First, to understand how a person perceives the behavior, and then how to take steps to course correct if their own perception differs from actuality. The objective of the study was for the researchers to understand how the participants perceive their health risk due to the risky behaviors and the real risk in order to attempt to better educate them. As the study was conducted in the Netherlands, the participants were 40 Dutch people who were interviewed as to their interpretations of the risky behavior in a qualitative study in order for the researchers to analyze and ultimately determine their mental models. The results from the study were then put into 4 different buckets for their perception. 1. Same factors with different values, such as stress. 2. Superficiality and incoherence, so a focus on health in general. 3. Misjudged and elevated risk concept, such as being sick or not. And 4. No concept of a link between cardiometabolic diseases or believing that the diseases are caused by something different entirely. The results showed that the participants are not completely ignorant of their susceptibility to risk. However, they fail to make the connection of how these risky behaviors can truly impact their greater health. By understanding these results, the researchers determined that in order to more effectively communicate the implications of these risky behaviors, the education needs to speak to the impacts on their health in a way that people truly care about and also use a different way to communicate the information. Before the study was done, the researchers determined the expert model and subsequently performed qualitative interviews with 40 participants. The expert model was formulated by both studying linkage between health and diabetes, CVD, and kidney disease, and also interviewing 9 experts in the field. Out of the group of participants, 21 were selected out of the respondent pool from an ad in the newspaper, 15 construction workers due to their variety in risk and demographics, and 4 participants from an immigration integration course. Participants were interviewed using open-ended questions and asked to produce their knowledge on cardiometabolic diseases and the risk that they posed. The participants were of a variety of backgrounds, with the majority being between the ages of 45 and 64. They were almost evenly split, with 55% of them being male, pretty much split with their education between low, average, and high, the majority, 3/4 of them, being from the Netherlands, and varying general health status. In the first set of results, within the same factors, different values bucket, the experts stressed presence of physical inactivity as being the precursor for the 3 diseases compared to the participants who cited lower socioeconomic circumstances and stress as the triggers. The experts also tended to focus on prevailing diseases such as edema and muscle pain, and also acute consequences such as stroke, while the participants talked about more long-term consequences such as amputations, paralysis, and dialysis. There were 3 quotes, one from a woman who said, "Can I also talk about the consequences that diabetes can have for people?" Well, people must administer insulin and eat regularly. They have to monitor their glucose levels, and they are thus disabled. A man said people with diabetes get black fingertips and ear laps. That's what I've heard. And another man said, what image do I have of CVD? My mother died from it, and I think of bypasses. In the bucket of superficiality and incoherence, participants displayed a basic knowledge of risks and causes. For example, exercising has a positive effect on one's health, but they did not attribute it to the reduction of the risk of disease. A woman said, you can inherit diabetes, but you can also develop it by an unhealthy lifestyle. I think of overweight and unhealthy nutrition, and overweight is a big risk factor for developing type 2 diabetes. There are two types of diabetes, and there are people who inherit it and people who develop it by an unhealthy lifestyle. So in other words, people who have it in their family and people who are to blame for it themselves. In the third bucket, misjudged an elevated risk concept. Lay people did not actually discuss the physiological factors associated with the disease. They determined that people were either sick or they were not, with no clear risk factors. They also had no delineation between risk reduction strategies and true medical treatment. One man said, if the doctor tells you that you're at risk, I assume that you get instructions about how to adapt to it, to keep away the risk or reduce the risk. So people have to adjust to what they're being told by medical experts. Another man said, it depends on the size of the risk, but after a consult with your doctor, you'll actually come into a treatment phase, for example, a hospital admission. In the fourth bucket, no concept of a link between cardiometabolic diseases, which discussed with experts, they are able to share this in terms of the causes. However, when participants are presented with the same information and even probed further, they are unable to determine that there is a link between a risk factor and the discussed diseases. One man said, people should first quit smoking if they smoke. That's something for sure. And then changing nutrition patterns and having more exercise. A woman said, if you know that you're at risk, you should adopt a healthy and more regular nutrition pattern. And another man said, we're all at risk to develop certain diseases. Healthy people have the same risk as unhealthy people. Even people who sport a lot and are very healthy can suddenly collapse. This study began by identifying a gap between the education materials presented to lay people on kidney disease, CVD, and diabetes due to people's mental models, and focused on how such materials can be enhanced so that people understand the risks that lead to these diseases. The studies show that although experts and lay people had overlap in their understanding of the risk factors, there were very distinct differences, especially related to elevated risk. The findings showed that the education materials need to focus on the factors that people find important, even though such factors may have minimal or even immeasurable associations with the risk. When presented with simply numbers, people do not take a personal feeling towards the risk of the disease. Materials also need to convey more details on the risk. Researchers do often, however, do not present too many details as there may be cognitive overload or complete inattention. Misunderstanding the elevated risk also needs attention, as the findings are so abstract in nature to lay people that a framework for this needs to be implemented. One thought is to present visuals of the physiological damage that these risk factors can have on one who engages in them. The researchers who performed the study determined that there is a need for more factual information when it comes to the risk factors, causes, and risk reduction strategies of diabetes, CVD, and kidney disease. The information that was learned through the study was instrumental in determining the participant mental models and how the information pertaining to these risk factors can be enhanced. As a next step, the researchers believe that testing their findings in different educational materials with these visuals can further determine what content should be presented. Thank you.